It's time now for our health segment, and joining us now is Africa 54 health correspondent Lino Mudu with the latest on a vaccine for Ebola in DRC.
That's right, Esther. Health authorities in the Democratic Republic of Congo are introducing this week a vaccine against Ebola in the country's eastern provinces, the current outbreak. The vaccine by Johnson & Johnson will complement another vaccine manufactured by Merck, which has been administered to more than 225,000 people. The new vaccine requires 2 injections 8 weeks apart, unlike the Merck vaccine, which requires a single shot. The inoculation process starts in Goma this week and will be extended to other provinces. Johnson & Johnson is donating 500,000 doses of its experimental Ebola vaccine for the trial in the DRC, where more than 2,000 people have died in the latest outbreak.
We are going to use a new tool that will help protect a number of our people against the Ebola virus.
For now, the vaccines arrive frozen in Goma and will be kept in the freezers behind me. They will be carried to the vaccination sites frozen and unfrozen progressively during the day to meet the vaccination needs.
The new vaccination will be administered simultaneously in Democratic Republic of Congo and Rwanda. Now, a new report from the World Health Organization says billions of people around the world have vision impairment or blindness. More than 1 billion people worldwide are living with vision impairment because they do not get the care they need for conditions like short and farsightedness, glaucoma, and cataract, according to the first World Report on Vision issued by the World Health Organization. The report says aging populations, changing lifestyles, and limited access to eye care, particularly in low and middle income countries, are among the main drivers of the rising numbers of people living with vision impairment. Alarko Sietha is the coordinator for blindness, deafness, and disabilities with the World Health Organization.
Today we can say is that there is at least, and I want to put the accent in at least, 2 billion people around the world with vision impairment. From these 2.2 billion people, at least 1 billion is living with a vision impairment that could have been prevented or is still to be addressed. Something needs to be done. To address the need for these 1 billion people that today do not have access to simple glasses or they do not have access to cataract operation, then the cost for that to address that would be $14 billion. One of the actions that we request or that we promote in the report is eye care services need to be integral part of the health sector.
The report says a stronger integration of eye care is needed within national health services, including at primary health care level, to ensure that the eye care needs of more people are addressed, including through prevention, early detection, treatment, and rehabilitation. We turn now to cancer. Nigeria accounts for the highest cancer mortality rate in Africa, according to the WHO. Low awareness, late detection, and high cost of treatment are major factors contributing to increasing cancer mortality in the West African nation. Several nonprofits in Nigeria are taking information about the disease to the streets and sponsoring underprivileged patients for treatments. Timothy Obiezu reports from Abuja.
Zainab Mohammed was a chief administrator with Nigeria's Judicial Service Commission when she was diagnosed with a malignancy in her left breast in October.
I saw the result. The doctor said suspicious malignancy. I know when it says malignant, it means cancer. That was when I was like, my life has ended. I was like dead.
With little faith about her survival, Zainab started fighting the disease. But the medical bills never stopped.
Managing cancer is very expensive. I had to look for funds from friends, family and friends, and at the end of the day I had to sell a house to pay for my medications.
By WHO's estimates, some 41,000 cancer-related deaths took place in Nigeria in 2018, the highest mortality rate in the world. While unhealthy lifestyles and habits play a role, low awareness, lack of treatment facilities, and the high cost of treatment in Nigeria are the major remedies. Launched a national cancer control plan last year in an effort to fix the problem. Early in the week, the government announced 50% discounts on chemotherapy treatments for patients. In October, several thousands marched the streets to create awareness and raise funds for treatment of cancer patients. Medicaid Foundation, a non-profit in Nigeria, has been serving patients for 8 years.
So far, we've raised over $1 million. We've impacted over 200,000 people. We've helped them, and we operate all over Nigeria. The impact is high in my state, in Kebbi, where my husband is the governor, because we reach all the 21 local government areas where we talk to people. We create awareness.
As the second leading cause of deaths globally, the impact of cancer is often greater in low and middle-income countries, including Nigeria, which lack adequate resources to support cancer policies for their citizens, making fundraising and awareness even more critical. Timothy Obiezu for VOA News, Abuja.
And that's our health report for today. To stay in touch, find me on Twitter @Linor Back to you, Esther.
Lino, October was the cancer breast awareness month.
Yes.
How much do women know, and how much is being reported in Africa, especially all these challenges we see with cancer?
Yes, Esther, as you mentioned, October is Breast Cancer Awareness Month, not only in the U.S. and Africa, but it's a global event. And we're seeing more awareness on the continent, and countries like in Ghana, Nigeria, Morocco, you're seeing breast cancer awareness walk, and people are going to the streets, door to door, to talk to women and men about cancer, breast cancer, because not just women get breast cancer, men as well. But from 10 years ago, there were less awareness. I think now it's encouraging to see that women in Africa are really taking into consideration the fact that cancer is not just a disease of the West.
Wow. Thank you very much, Lino, and good to have you back. We need to hear more from you.
Thank you, Esther.
You're welcome. All right, be sure to watch Lino Mudu's health reports every Tuesday right here on Africa 54.